Come in.
Hi there, I'm Dr. Merrill.
Hi, nice to meet you.
Nice to meet you. I understand that you had a concussion this weekend.
Yeah, I was playing in a recreational football game, and I was the ball carrier. I was running downfield, and a defensive player tackled me, and then a bunch of players fell on me, hit my head on the ground.
Okay. How did you feel after the play?
Felt pretty woozy. The referee called my athletic trainer, and she came on the field and took me off and told me that I had a concussion.
Okay. Do you remember having a headache?
Yeah, I felt a little kind of out of it, had a headache. My teammates told me my balance was a little bit off as well.
Okay. So now it's 3 days after the injury. How are you feeling today?
I feel better. Dizziness is somewhat resolved, and I feel more with it. I still have a headache, and just overall don't feel myself.
Okay. Where's your headache?
So it kind of starts in the back and then wraps around, and I think the main one is kind of the base of my skull.
Okay, sure. Are you having any neck pain?
Yeah, my neck does hurt, to move it, or I lay down at night to sleep, or when I'm driving my car, it kind of hurts to move my neck.
Okay. Any stiffness or loss of range of motion?
I mean, I can do most things, it just kind of hurts when I do it.
Okay. Any numbness or tingling radiating down your arms or your legs?
No,
And any shooting pains going down your arms or legs?
no,
How about weakness in your extremities?
no.
Okay. Let's go ahead and examine you.
Okay,
Okay. Time out. So based on the history that this patient is giving you, you know that he's had a concussion and that he was already evaluated by the athletic trainer. What we start to worry about as patients come into clinic are red flag symptoms. Does this patient have any red flag symptoms that you would be concerned about? So now that you've discussed what red flag symptoms you might be concerned about, what kind of things are you going to look for on the physical exam? So at this point, we've done the physical exam. As previously discussed in the curriculum, anytime a patient comes into the clinic, you want to go through a SCAT-3, BEST testing, and vestibulomotor testing to see how their symptoms are doing and gauge how they are going forward. We've already done that with this patient, so we're just going to show you some of the pertinent positives. Time in. So I'm just going to examine your neck real quick. As I'm palpating over the spinous process of your vertebrae, are you having any tenderness?
yeah, it does kind of hurt there.
Right here over the bony vertebrae?
Yeah, if that's what you call it.
Okay, all right. Let's test your range of motion. Can you bring your chin to your chest? Looks like that's a little bit painful.
Yeah,
A little bit, okay. Let's have you bring your head back. That's okay. Can you look this way? Good, and look the opposite way. Good, so you have a little bit of decreased motion when you rotate. And how about bringing your ear to your shoulder? And on the other side? A little bit decreased lateral side bending as well.
yeah, I feel like I can do all of them, but it just kind of hurts.
In that same area that I pressed on?
Yeah,
Okay, let's test your strength. Arms up, push up towards the sky, and down towards the ground. Arms out like this, push out towards me, pull in towards you. Good. Arms like this, push up like you're going to rev a motorcycle. Good. Good. Bring your leg up like you're going to do a cannonball. And this side. Good. Kick out towards me, pull in towards you. Good. And feet up towards the sky. Excellent. All right, so let's test your reflexes. Good, so your reflexes look okay.
so
Time out.
So with my neck pain and hearing the story, what do you think is the red flag, and how would you proceed? What are the next tests or the next steps you would do to figure out what's wrong with this patient? So based on my neck pain and the difficulty with some range of motion exercises, that would be considered an atypical finding for a concussion and something that would raise the possibility of a fracture or injury to the cervical spine. What we recommend doing is getting cervical spine x-rays to rule this out. In addition, it's a good time to have a reminder that any patient or athlete that has a cervical spine injury or that you're suspicious of such, the patient should always do the range of motion. So it should be active range of motion for the patient to make sure that you're not worsening any injury they may have to the spine. I'm in. So what do you think's going on?
Well, Alan, I'm concerned that you're having neck pain that's hurting when I'm pressing on your spine. It's normal with a concussion to maybe get some stiffness and a little bit of a headache, but when it hurts to press on the neck, we worry that there might be a cervical spine injury, like a fracture. So what I want to do is go ahead and get some x-rays of your neck to see if there's any bony abnormalities.
Okay, thanks Doc. You're the best in the West.
You're welcome, Alan.